Yeah. A hearty good afternoon and welcome to the session about seasonal flu in children. We are glad to have Dr. Nasima Rao among us today to help us understand the topic. He will take us through that and more in this session today. Doctor, you have the stage.
Yeah, thank you. Thank you for this opportunity to speak on the seasonal flus in children. At present, there is a lot of flu and a lot of children getting sick because of this cold, cough, and having some flus and all. In recent past 2 weeks, there is a surge in cases in many metros and many cities and all. So I just want to talk on basic things about flus in children. Seasonal flus in children are very common in the months of monsoons and the months of winter. So the main thing is influenza virus is one of the main cause for the seasonal flus. So influenza virus, we discuss about very small little about that that virus, and we'll go into the other parts of the influenza. So this flu is called influenza virus, is known as seasonal flu. There are many types of influenza there. Four are more important. In that, A, B are more important. There are A, B, and C, and which one A and B causes lot of epidemic cases, lot of signs and symptoms, and some have a major illness as well. So we discuss on influenza. Influenza is a virus, so which will affect our respiratory system more, and child will complaints of cough, cold, repeated body pains and all. So this is more common in children who are all going through this phase of life. So influenza virus is of three types: type A, type B, and type C. In this, type A and B will cause a lot of infections, and type A will have a much milder form than type B form, and type C there won't be see any majority of the cases. So many will ask me, what is the cause for this? The cause for all seasonal flu, the main culprit is influenza. Influenza A, influenza B, they are more important culprits for this flu season every year. And second thing is, how does it transmits? It transmits through the droplets. As everyone know how COVID has brought us into the knowledge of this droplet infection. The same thing, it comes to the droplet infection. So whenever an infected child or infected individual has sneezes and coughs, the droplets will travel and will get infect the other person. So the mode of transmission is infected through a droplets. Then next thing, how we can know that child, like what are the signs and symptoms, that we'll discuss later. But how can when the child become more symptomatic? One day, suppose if anyone is exposed to this influenza virus, so they will start emitting the virus to other people. So they start transmitting the disease to the other people day one, before the symptoms, and now until 5 days to 5 to 7 days. So any child is in the school, any child in the playground, any child was affected with flu, they will be transmitting the virus to other children. So, and that's the reason why if any children is having cold, cough, and these flu-like symptoms, always better to isolate for 5 to 7 days, where the transmission rate can be decreased. Second and third thing. So, what are the signs and symptoms of this flu? High grade fever will be there. There will be chills and severe fatigue. They feel a lot of tiredness will be there, and a lot of fatigue will be there. Complaints of headache. I have seen children coming to me to my OPD and telling with they have a severe headache which they are never experienced in their life. So that much of headaches will be there. They will have muscle pains. Along with that, muscle aches will be there. Then non-productive cough. Non-productive cough is like they will have a lot of dry cough will be there. Then sore throat. So many people will get confused whether it is a flu, whether it is a common cold. Now we go into the some topic like how to differentiate whether your child is having a common cold or else whether your child having a flu symptom. Very thing is symptoms of onset. Suppose the symptoms of onset is gradual. Say symptoms I told like high grade fever, chills, fatigue, and headaches, muscular pain, non-productive cough, and sore throat. If these symptoms are if these symptoms are gradual in onset, that means slowly growing from one day to other, the symptoms are hiking up, that is a feature of a common cold. Whereas in flu, all of a sudden, abruptly, the child will land up into high grade on the day one itself. They have chills on the day one, fatigue, what all symptoms are there. They have a manifestation on the day one itself. But common flu, it will increase daily. The symptoms will progress daily. So any symptoms are progressing daily and going into the severity, that is more in favor of a common cold. Whereas In flu, it will be at an abrupt onset. Then fever, in common cold, the fever will be rare. I have seen many children, even many children are there. They have cold, they have cough and all, but they don't have a fever. That fever is very, very common in terms of flu, but fever is very less common in terms of cold. Then aches, body aches. So these body aches are very mild in case of a common cold, but in case of flu, these body aches are very much high and very much. Sometimes the child feels like not going to anywhere and taking a rest. Then chills. Chills are highly uncommon in terms of cold, but chills are very much common in terms of flu. Then fatigue and weakness. You can see fatigue and weakness in common cold very less, but in flu you can see fatigue and weakness. Then sneezing. Sneezing is very, very common in common cold, but in flu the sneezing will be sometimes very little. The sneezing is a part of a common cold, but sneezing is not rare, it is not common in terms of flu. Then chest discomfort and cough. So when the child have a mild to moderate cough will be there in case of cold, but in case of flu, it is very, very common to have a chest congestion and a cough. Then stuffy nose, very common in the cold, and it is some stuffy nose is a feature of cold, but stuffy nose is not a feature of flu. Then sore throat, very common in both, but in flu it is sometimes, but common in terms of a common cold. Then headache. Headache is very, very rare in case of a cold, but headache is very common in case of a flu. So the differentiation points are very clarity is that flu is a abrupt onset of all the symptoms like high grade fever, headache, muscle pains, and what you call sore throat and non-productive cough. Whereas common cold will have gradual onset of symptoms, gradual progression of symptoms, and they have stuffy nose, they have a lot of running nose, they have sneezing, but fever is very, very rare in case of a cold. But in flu, fever will be abrupt and they have a lot of chills and rigors. So what to do? The child has manifested all the symptoms on the day one. So always go to the practitioner nearby and take an advice from the pediatrician. So what are the things we can anticipate? Treatment is a proper recovery. Almost most of the people will recover in 1 to 2 weeks. So anyone who is affected with the flu, they will be recovered in 1 to 2 weeks completely. The thing is, the first week is an incubation time where 5 to 7 days they will be symptomatic and they will be spreading the disease. Second thing is there are a lot of treatment is there in terms of syrups, in terms of flu, Tamiflu, oseltamivir, that you can give in case of a influenza. Suppose, how do you diagnose influenza? Through swab collection. Everyone knows that how swab is collected. This COVID has taught us many things. So the swab collected from the throat swab, that the swab will be correct. Then that swab will be then the swab will be sent to the lab. And whenever it comes influenza positive, then we start using all the medications as per the needed. If it is not influenza positive, we'll treat accordingly. So there are many things to be sorted out before treating a flu. Then what is the other thing? So symptomatic treatment is the treatment of choice in case of flu. So what are all the symptoms are there? We'll try to treat each and every cough. We'll treat the cough, cold. We treat the cold. What is body pains? We'll treat the body pains. Fever. We'll treat the body pains. And after that, we'll start an antivirals called oseltamivir in case of flu. Then how to prevent this disease? Vaccination is one of the best ways to prevent this flu. So now we have an vaccinations are available, flu vaccinations. So yearly vaccines are available. Any children from the age 6 months until 8 years, the child to take yearly vaccination for flu. So the right time for vaccination will be just before the monsoon, like in the months of July last week or August midweek. That's a good chance to get the vaccination. These vaccinations will help us to decrease the intensity of the disease in that when it comes in the peak stage. See, flu will have epidemics, endemics, and sometimes sporadic cases will be there. Yes, there are epidemics of flu because the flu will be rampant. It will be transmitting to one child to other child very fast. So the thing is, I advise all the parents to take the vaccination to the children, flu vaccination every yearly shot. Initially, we'll give two vaccinations and the 4 weeks apart. After that, yearly once we'll give a flu shot. The problem is every year flu shot is because there's something called antigenic drift and antigenic shift. These two things will make the viruses into more mutated form. So we have to take every year that vaccination. Suppose 2022 vaccination, they'll give the strain for 2022. So 23 they have a different strain. 24 they have a different strain. So every year they'll make a strain specific thing because of the antigenic drift and antigenic shift. We can't have a vaccine same thing for years together. So every day, every year, there's a change in the vaccination. That's why we advise the children to take the vaccine every year, just before the monsoon or during the monsoon stage. So any child was infected with influenza, there's nothing to worry. Consult a pediatrician nearby, treat according to the symptoms, and take vaccine at an appropriate time. Influenza virus, if you treat well, it is good, because the complications of influenza virus are sometimes goes beyond our imaginations, because the complications are pneumonia. It will cause bacterial pneumonitis. Because of severe immune suppression, they have viral pneumonias. And we have treated the influenza child with HFNCs, with CPAP, and even sometimes it go to the terminal phase of life. So don't neglect influenza. We have the vaccines, we have the treatment, and we know what to do. Always prevention is better than cure. How to prevent? Vaccination, masking, social distancing, hand cleaning, these are all more important thing. Any child in the school, any child in the home is having this symptoms of flu, try to isolate the child, or try to treat the child accordingly, and vaccinate the child in time. This will help the child to not to go into an influenza. And we should able to differentiate between common cold and flu. Based on that, the treatment is depends upon. So the cold, which is common cold, is different from flu, and flu is different from COVID. So COVID symptoms are, as everyone knows, that they have high grade fevers, decrease in saturations, lungs get involved, as what they call high grade fevers, cough, troublesome cough. Flu is like child will be stable, but the symptoms will be abrupt. So influenza is also known as a seasonal flu, which will cause outbreaks in many places. And recent we have an outbreak in many metros and many big cities. So the high grade of fevers, any child with high grade fever, sudden onset of high grade fever, chills, rigors, muscle pains, headache, and sore throat, always think it is a flu and treat like a influenza. So I think I'm done with my influenza today, because most of the seasonal flus are due to influenza. Any questions are there, we'll go through it. I think I can add, I can give some questions on my own so that everyone will get good information. So, what causes influenza? I told you influenza A, influenza B, and influenza C. Out of those, influenza A and B are more common, and they have more symptomatic. So what causes influenza? There is virus is an influenza. They have street cells. So how does it spreads? It spreads through the droplet infection. So through sneezing, through coughing, and through touch of the surface, and being close with an individual, you will get this thing. So how long it takes to develop symptoms of influenza after being exposed? Suppose if anyone is exposed to influenza, how long it takes? The incubation period of influenza is 2 days. So after 2 days, I mean 2 days, but can range up to 1 to 4 days as well. So it takes around 2 to 4 days to develop the symptoms after what you call after exposing to the influenza. What are the symptoms? We discussed high grade fever, chills, headache, what's not everything, eye pain, sore throat, non-productive cough are there. So how serious is influenza? Yes, if you're not treated well, it will be serious. It will be terminal. Sometimes the child go to respiratory support. So it's always good to treat, early to treat, and early recovery will be there. So what are the complications of influenza? Pneumonitis is one of the dreadful complications of influenza. Then one more thing is myocarditis. Any viral infection will cause myocarditis. So influenza is no bit different from that. So apart from being getting pneumonia, this virus will also cause myocarditis. So any other questions? Even best way to prevent influenza is vaccination. So how long you take vaccination? 6 months to 8 years of age, every children should go through flu vaccination yearly. So what are the vaccines available? There are vaccines available who four strains vaccine. Every strain specific vaccine is available. So is there any drugs to prevent this? Yes. Once you got flu, we have many drugs. We have oseltamivir, from like generally called as Tamiflu. Then we have zonamavir, is called Relenza. Another two more drugs are there which are under trials. Rapivobab, monoclonal antibodies are there which can be used for treatment. So how long when a person with influenza is contagious? Suppose if I was infected with influenza, when how long is any individual who are infected with influenza, they are contagious. They can transmit the disease for 5 to 7 days. So 5 to 7 days, any child or any individual who got influenza, they can transmit on the disease to the nearby individuals. So can you get a influenza more than once? Yes. Influenza virus changes frequently, and the infection of one strain does not provide protection in another. I told there are strains in influenza. So the one strain infection does not produce any sort of safety for the other strain infection. Yes, you can get infected with twice, more than once in a year because the strains are different. That's the reason why I told the genetic drift. Genetic drift is the reason for this thing. So that's why you should take the specific strain vaccine every year. So I think the first influenza vaccine was in 1945, which was made by the United States of America. So vaccination is an inactivated vaccine, recombinant vaccine. So post vaccination, child may get a mild fever, but they'll have a immunity towards that specific strain. I think I'm done with my questions. I'm done with the topic of influenza. If any questions are there, we'll let answer, or else we'll close the session. One more thing I just want to add on. Apart from all those things, every child should be immunized properly, and every child should get proper immunity. So immunity will be of many types. It depends on the diet of the individual. It depends on the vaccination of the individual, and it depends on how he is exposed to a specific disease. Not all diseases will have vaccine. The vaccines will be there for the diseases which are dreadful diseases. So the child should sometime the child should get exposed to a disease and get immunity. And for the immunity diet is more important than vaccination. So if your child want to get immunity, there are three ways. One is exposing to the disease and getting a vaccine. Sorry, expose the disease and getting immunity. Second thing is vaccination will give immunity, and proper food and proper nutrition will give us a lot of immunity. The immunity in the child will decide the progression of the disease. If the immunity is good, they won't allow the disease to progress. If the immunity is weak or suppressed, or else if the immunity is not up to the mark, the chance of disease progression is very high. Not even influenza, any diseases will progress in the child if the immunity is not able to combat the pathogens. So all my take carry message is immunity in the child will defeat many diseases. So how to build immunity? Proper nutrition, proper vaccination. These two will help the child to get a good immune status, which will help the child to sustain what all infection they will get during their lifetime. Any questions? I think we can wind up this session. So I just want to add on one more thing and we close up. Common cold and flu are not same. Common flu and flu are not same. Common cold and flu are not same. So common cold can manifest like common flu, but we have to differentiate what is flu and what is common cold. So common cold, the child who won't have fever. Whenever you suspect a fever with the symptoms of cough, cold, and other things, we always suspect influenza. And carry home message is vaccinate your child every year before the monsoon to get immunity to combat influenza in the winter seasons. Especially vaccination is mandatory for the children who are asthmatics, who are diabetes, who are all under chemotherapies, who are all bedridden, who are all under the drugs which will impact the immunity, like steroids and all. So children who are on steroids, children who are on monoclonal antibodies, children who are on chemotherapies, children who are on diabetes, and children who is having a less immunocompromised state, they should take the vaccine for sure. This vaccine will help them to not to get the influenza. So that's it. Thank you for this time, and I think I can conclude the session. Can we stop?